If you what exactly is this ECG, you may think why this doctor is giving ECG machines to the society instead of getting the patients for ECG and making big bucks. He's a cardiologist. Why should he give the ECG machine to the society? Can't he just call them, all of them here and do the ECG himself? You are mistaken. I will just give you some facts and figures and some statistics. Being a cardiologist, I see a lot of heart patients every day, day in and day out. We see heart patients, and you will be surprised that our country is galloping towards attaining number one position in one aspect of life. In terms of magnitude of coronary artery disease, we are going to be number one sooner or later. In our country, 30 million people suffer from heart attack every year. And you will be surprised that more than 1/3 of them, they don't reach the hospital. They have a heart attack, they take some treatment or the other, but they don't reach the hospital. So you see the enormous burden of these patients who are in the society, who are sometimes lucky to be diagnosed, or they are left without a diagnosis. So what we have seen and what is the fact is the diagnosis of MI is delayed because of unavailability of the right kind of equipment or the tool. So you may wonder how we can improve this. So there are a lot of studies they have seen. In Indian case scenario, there is a Kerala heart study which said more than 50 to 60% of the patients take 10 hours to reach the hospital wherever they are, whichever place they are. It may be a village, it may be a small town, or sometimes even in bigger cities. The patient takes almost 10 hours to reach the hospital after sustaining a heart attack or heart related symptoms. Why there is such a big gap or delay in reaching the hospital? That is because of failure on the part of the or even the general practitioner or grassroots level physician or practitioner to make a diagnosis of acute MI, what we call myocardial infarction or a heart attack. Why there is a delay in making the diagnosis? Because of one, unavailability of the machine, and second thing, of course, false alarm. People may think the symptom is related to acidity or something else. Now what we have found is, with our last 4 years of relentless persistent efforts of finding out where exactly the problem lies, I've been collecting a lot of demographic data of patients whom I used to see in the last 4 years. Of course, I've been doing this, but particularly, I started developing interest in the last 4 years and started identifying where these people are having the problem, which village or which grama or whatever we call them, which taluk or tehsil. And then we found out that there are few areas where there is absolute need for a diagnostic aid like a ECG. We mapped all those things. That time there was no WhatsApp. This was almost 5-6 years ago. WhatsApp came only, I think, 4 years back. Then we started, tabulating the data and kept it in our data sheet. Then came WhatsApp. We started collecting the data of all the doctors who are in this grassroots level. Started collecting their data. Once we made a data of them, we made a group of these doctors. When I made a group, the group was made 1 year ago. I told them that you need to be very choosy, and you need to know when to identify symptoms. Once you identify symptoms, you need to take a ECG. But most of the time, doctors used to tell, we may be able to make a diagnosis, but we don't have the ECG. We don't have the ECG machine. What do we do? If you refer the patient in the transit, patient may die. So for that, we thought we need to break this jinx of lack of availability of a ECG machine. So it was not easy. See, giving an ECG machine, 1 or 2 people may give, 10 ECG machine you may give, but if you have to support the entire district or maybe more than a district, it is not easy. How to convince the people? So I started going for lectures. In the last 2 years, I have taken several CMEs or lectures, went to the corporate houses, business establishments, KOCL or MRPL or let's say KMF, the banking sectors. That time I went and gave the talk on cardiac education and warning signs of a heart attack. That took me almost 2 years to make them understand that they need to be aware about the cardiac symptoms. Once that was done, this year I formed a group called as Cardiology at Doorsteps. This was a WhatsApp group which had 256 doctors, and now I have made a second group. Another 90 doctors have been added. None of these doctors are physicians. None of these doctors are specialists. They are all grassroots level doctors. They work in primary health centers, community health centers. They work in small hospitals. They are in the villages. Networking them was also a challenge, because sometimes when I used to call them, they used to tell no network, no availability of mobile phones. But somehow we managed to do over last 6 months. 8 districts have been networked, 256 plus doctors in one group, another 18, another group. So now we have a robust platform of almost 350 doctors from 8 districts who are all connected through one WhatsApp platform with one motto of diagnosing the heart disease early, what we call CAD, that is cardiology at your doorstep, the acronym. So that is how it all began. And we started identifying the problems. Then once we identify problem, once we identify the villages or where the exact problem lies, we started calling them and educating them. And I did a conference called Anveshana recently, 2 months back, in the very same place, where again 250 doctors we called from all over Karnataka, gave them half a day CME on how to identify simple ECG techniques of identifying a heart attack, at recognizing the symptoms and then diagnosing. There it all began, and then in the last 2 months we have donated around 25 ECG machines. Our aim is to touch maybe another 25 by next month, and total 100 machines by the year end. But having said that, it is easier to say the numbers, but without the support of the government, without the support of the big establishments, we cannot achieve total, disease-free society. We need to have a lot of donors and a lot of entrepreneurs to donate for this cause. Just to conclude, I want to highlight that our state of Karnataka, with 2,500 primary health centers and maybe another 500 community health centers, need at least 2,000 ECG machines in addition to what they have right now. 2,000 ECG machines. It's not a small number, it's a big number. But for the government, it's very easy. 2,000 ECG machines, they can easily call tender and they can give it to all the primary health centers. But the most important part is identifying the problem area and giving it to those places. I think with this introductory speech, I will now just unveil what we are going to do today. We are going to call 10 doctors from 10 villages. Okay, I won't call villages, it may be a small town, or some are really villages, but these are all from a primary health center. They all have come. When I was talking to Dr. Venkatrai Prabhu, Dr. Unnikrishnan was also there. So, as an afterthought, he told me, do you have one more ECG machine for us? So I was surprised why he needs for community medicine department. I never thought community medicine needs an ECG machine. Then he said, no, for our urban health center in Lady Hill, we'll definitely need one machine. So I told sir, already we are, short of budget, but I'll try. But luckily we have now a lot of awareness. I think media has given good coverage in the last couple of weeks, and we have got a lot of donors, a lot of business houses have come forward. People have given good support for our project, and I could the very next day I called sir as well as Unnikrishnan sir, and we have given one machine to the Lady Hill Urban Center. I am happy that it is going to our own center. So without much